Hello, and welcome to another edition of Health Matters. I'm Dr. Bruce Karlin, your host, and I'm delighted to welcome two of my favorite people for what they do for the city of Worcester and the region. Dr. Michael Hirsh is our medical director of the Department of Public Health, and Tina Grosowsky is, and I'm going to get this right because I got the card in front of me to help me here, is the project coordinator for the Central Mass Tobacco-Free Community Partnership. And we're going to talk about vaping and all of the things around it. Welcome to you both.
Thanks for having me.
Yeah, thank you.
This is such an important topic. I'm going to just reel off a little bit of my own feelings on this. To start with, I was very much for the original e-cigarettes when I was trying to get patients off of tobacco, but what they've morphed into has become absolutely monstrous. And you folks know this much better than I do. I'm really reluctant to put any of my patients on vaping products, just because of what they've morphed into. Maybe, Tina, you could help us and tell us about what's happened with the original product versus what it is now.
Sure. I think that, well, we know that combustible cigarettes, traditional combustible cigarettes, there's nothing worse for you than combustible cigarettes. So when they designed the e-cigarettes, it was to help adults quit smoking. But unfortunately, some of the companies, especially the most popular brand with teens now also is Juul, and they made a formulation of the nicotine salts which is so strong that it really creates an addiction in very short time for young people. And then the recent epidemic, as you alluded to, has really caused a lot of concern in the past couple of months. So it's gone from a product that was seen just by some people as harm reduction, but now we know that it's not safe really for anybody at the moment.
And that brings us to the recent crisis where, lo and behold, we've got some people that are dying after vaping or at least coming down with pretty serious lung disease. Maybe you can describe where we stand on that, Mike.
Right. Well, you know, this is a very strange disease that we are facing. It doesn't fit a lot of the different categories of traditional interstitial lung disease or bacterial or viral lung disease, and it's striking young people who ordinarily would have, we would think, the immune competence and resistance to these kind of diseases so that it wouldn't be as fatal or catastrophic as it can be. So when the governor decided that the statistics that the Mass Department of Public Health were presenting him, where we had at least now 68 cases of documented vape lung, of which there have been 3 fatalities. The average age of the patient has been about 50 years old, and the breakdown male to female is slightly more female, 38 to 30, female to male. But they've been really searching for the epidemiology and the clues that might link these patients. It seems like 40% of them have just been using nicotine products, at least this is self-reporting, we can't prove it. The other 60% have admitted to mixing their device with THC, the active ingredient in marijuana, with a nicotine oil, and those patients seem to have a higher predilection to get this problem. So 60% have this mix going on, 40% pure nicotine. But whatever it is, it had such a high rate of severity, and we've had 3 fatalities just in Massachusetts, that I think Governor Baker was very, very courageous and proactive and said, until the CDC knows what's going on, we can't continue to sell these products. And that's when the ban came about. And it's met with a lot of resistance because where these products are being sold are usually retail shops that are owned by, in many cases, hard-working, first-generation Americans who are trying, obviously, to make a living and put their kids through school and all of the things that the American dream is about. But this has nothing to do with being anti-immigrant or anti-retail. It has everything to do with trying to stop a fatal disease from spreading in people in the prime of their lives.
So, go ahead, Tina.
Right. So that, like Dr. Hirsh is saying, until we know what the cause is, the most prudent thing is to stop all sales, and that's what he's done here in Massachusetts. Of course, before that, cities like Worcester and 150 other communities have already put restrictions in place to protect young people and restrict the access to these products for young people. So the flavor restriction, which was put in here in Worcester, and has been successful in reducing the sales of these products for young people. So while I think we were on the right track to begin with, this has presented itself with a whole heightened level of concern. And thank goodness here in Massachusetts we haven't had any teen deaths related to this yet.
Well, a couple of things that you brought up speak to my own practice. First off, I think that it's probably underreported. Excuse me. I have a patient who developed interstitial lung disease. Excuse me. And I asked her about vaping when all this came out, and she said, "Oh, no, I've never done that." And then her kids have recently told me, "Of course she did." And she said, "Oh, my God, that's right, I had." And I think we're going to find more of that. The other thing that strikes me on this is, maybe you can dig into this a little bit more, Tina, is just how this has been perverted from the original good use of lesser amounts of nicotine. Nicotine is ridiculously addictive. I've told you this story before. My father was the chief medical officer at the liberation of some concentration camps in World War II. And they would offer these walking skeletons their K rations, and they would turn them down. They say, "No, just give me a cigarette." Cigarettes are ridiculously, nicotine is ridiculously addictive.
Right, and of course, especially for young people whose brains are still developing, back in the day when they did the research at UMass, in fact, was Dr. DeFranza, and he did the research that showed it only took 5 or 6 cigarettes for the adolescent brain to become addicted to nicotine. So these new products, especially like the Juul, each of the flavor pods that you put into the device are equivalent to a pack of cigarettes worth of nicotine. So that's a lot of nicotine for an adolescent brain. And I think that with the industry marketing these products towards young people, that's a copy and a playbook from the tobacco industry, using billions of dollars to advertise and market these products to where young people are on social media. So using Instagram, Snapchat, Twitter to get young people to take their own photos using these products and then share it and share it and share it, has created this big epidemic, especially of young people using these products. So and I've been hearing from pediatricians, and I'm sure you've probably heard yourself, that many young people are coming into the clinic with what looks like pneumonias or respiratory infections, but it's not that, and that it ends up being these vaping-related infections. So it's not something that is safe at any level, whether it's for a young person or for an old person. And we know that we don't want young people to start using nicotine using these products.
So instead of being an exit from smoking, it's become an entrance to addiction with nicotine.
Right. And, my mother is 94 and was a concentration camp survivor and became addicted to cigarettes briefly while she was in the Canadian Army after the Canadian Army liberated the camp. And it took her about 10 years to stop smoking after that. But I'm a big student of history. As a matter of fact, I'm giving a grand rounds tomorrow about the Battle of the Bulge and the medical support for the poor soldiers in the winter. The 75th anniversary is next month. But what was so unbelievable as I dug into this, and I went to Bastogne this summer, and I went to the World War II Museum, every single kit that every single GI got, and these are all the same age patients, we're talking about the teens, were filled with Camels and Lucky Strikes, and that's the whole giant generation of people that became addicted to nicotine and all of the lung cancer that we saw. And the tobacco companies knew what they were doing to these guys, and they never, as much money as has been settled and they've put back into mitigation funds, it can never buy back all of the poor people that died of lung cancer. So fast forward now, it's 75 years later, and we have a new industry popping up trying to get people addicted and also claiming, as they did back then, it's harmless, it's so much safer, it's a way of,
It's
of getting
safer than strychnine.
Yeah, exactly. The main company that's producing the biggest problem is Juul. They went from having zero revenue to $38 billion in 4 years. So, this is a playbook that keeps getting rewritten, different devices and fancier delivery systems. But the sad fact is true that we are facing an epidemic. Whether or not the vape lung thing takes off as the main problem, I think it's going to be cardiovascular disease and so many of the other sequelae that we know people get from the nicotine side.
Right, because we don't know the long-term effects of these products. We know the long-term effects of combustible cigarettes. There's no refuting that. But since these are new, we don't have the long-term. And we've already seen in the short term what kind of damage they can do.
And the FDA has to be really held accountable because they didn't choose to regulate these initially. And so much got out on the market that by the time they started to act as if they
It was
had
a
some
seemingly good product. We as physicians bought into it. We said, well, if you just have nicotine there and you've got smaller doses, the patch was good. We know that, you get some irritation for some people, and you might get nightmares if you leave it on at night. But, geez, it got people off of cigarettes. And we just knew how bad cigarettes were. We were talking at the start of the show about a lot of the misinformation coming from big tobacco about, first, no, it really doesn't cause cancer. Oh, no, it really doesn't. And there's some interesting stuff about the paid-for misdirection by paid scientists to obfuscate and obscure what was really going on with cigarettes. And they didn't even have to do it with the vape products because they said it was assumed that they were better than the cigarettes you were smoking.
Right, and the Juul company itself now was bought by Altria, which is one of the big tobacco companies, 35% ownership. And since they've been having all of these media problems and public relations problems over the past 6 months, they fired their CEO. They hired a top tobacco executive to take over the company, so that they've pulled back from the market. They're positioning themselves as being good players. They don't want to have any detrimental effects on consumers, and hoping this will all blow over so that they can restart their marketing up again and figure out another way to get people to get to
You
started
sell
on
an
it.
addictive product, somebody's going to subvert it. So how has you said you've met with the governor and basically the entire public health community behind this?
Yeah,
Mike?
I think people were very impressed that the governor pulled the lever on this ban. There was, we certainly internally in the public health community were wondering whether we could push it forward, because usually this isn't a real heavy lift. But Governor Baker, to his credit, again, I think he recognized this was something that Monica Burrell from the Mass Department of Public Health was really making a solid case that we didn't know what we were spreading here by allowing this to continue. So I think it was a very courageous and correct move. And we're getting more information. We're really following the lead of the CDC. The CDC is doing their best forensic analysis of what it is that might be the unifying factors. And there was some information that came out this week that some derivative of vitamin E acetate, has been found consistently in several of the more severe cases. And this is mostly produced when the mixture, like I mentioned before, of THC and nicotine products are vaped. That's as far as we know.
You've got to believe that heating up a hot oil
Right.
and then inhaling it can't be good for your lungs. I mean, we knew this with the lipoid lung long ago, that there were all these interstitial means in the fabric of the lung. The interstitial diseases had to come out of this, although we never tested. In hindsight, that looks crazy that we didn't test it, but we really didn't, did we?
So it's the vaping, the heating up, it gets into the airways, and then there's also the trace chemicals that are there, like the acetate and some of the other known carcinogens. We just don't know the long-term effect of them. And the flavoring. So the flavoring, which is the most attractive piece to young people, is a chemical, diacetyl, and I think we talked on your last show about the negative health consequences of heating up the diacetyl. We know from the microwave popcorn industry, and the workers got sick, and they were developing anomalies on their lung. So the FDA did come in that case and said, okay, well, you can't use FDA,
You don't have FDA approval.
for the diacetyl, so you can't use it anymore here. But where are they using it is in all of these e-cigarette products, which are not regulated by the FDA except for sale. So they've allowed them to be sold, but no testing, no making sure that what's on the outside of the box is exactly what's on the inside of the packaging. So they can say, well, this has 5 milligrams of nicotine, but maybe it's really got 20, because how do you know what's on the inside of the box? Or it can say it has no nicotine, and then you turn on the round on the back of the little bottle, and it says 15% nicotine. So, there's no oversight of these products.
So is that coming back into the purview of some of our regulatory agencies, or is that being considered, or are we just?
It's definitely being considered. I don't want to complain, but I
Why
was
not?
just talking to Tina before that, public health departments around the state and around the country are woefully underfunded and understaffed. We don't have a enforcement arm. We can find evidence of misuse of products. We can find evidence outside of schools that flavored tobacco products, wrappings are around, so we know that the kids, even with the ban that Tina referenced, that our Board of Health was very, I think, proactive in putting together. They're still getting the product, unfortunately. I think we've cut back their access a lot. But we can't, like hand out a ticket or do, we just don't have that kind of capabilities. And, if we got the funding that we needed, I think that the work that Tina does is so important because a lot of it is about education. I don't know if I were a teen now and I actually saw
You just
pictures
barely
of somebody.
escaped, Mike.
Yes, right. If I saw a picture of some of the patients that we've seen with the vape lung issue on a ventilator, struggling, for
It's
life.
a terrible disease. It's you struggle for every breath.
And I think that, having worked with other areas of prevention with, teen driving and gun violence, I think the more graphic you get with teens, the better it is. So what I would like to see is these $38 billion companies have to really pay out some kind of a mitigation fee that would allow us to really put together some clever media campaigns. We are working with Holy Cross right now to come up with a youth-directed anti-vape program that would include like these little memes and vines and short messages that would come out on their cell phones to warn them of the dangers and to make them aware.
Unfortunately, we're fighting a much better funded group that's trying to sell the products
Sure.
and get people addicted.
So we do have a new campaign, and like Mike said, back in the day, there was a lot of money that got put into media back when everything was really well funded. The new campaign for youth in Massachusetts from the State Department of Public Health is called Different Products, Same Dangers. So there's posters and there's social media that goes out, and we do want young people to associate vaping with cigarettes because all of the same messaging around addiction, around the industry targeting them, and that there's cancer-causing chemicals in these products. So this has been out now since the spring, and it's been on social media where young people are. And the main messaging is that these products are not water vapor. This is the oil that we were talking about. So we know that education is really important, especially on the cell phones where young people are now using social media. And we also have some new quitting apps that are available for young people because they are on their phones. So one is called This Is Quitting, where they can get text messages sent to them on their phones, how to get through the day. And then My Life, My Quit, which also shows them how to get connected with a trained tobacco treatment specialist that's been trained as a coach to work with youth. So they can, again, get information and help throughout the day. So when they're sitting in math class and the vice principal has just taken away their Juul, they can text to the counselor and say, I've lost my Juul, but I have to get through the rest of the day. What can I do? Or, I'm having anxiety. I'm feeling nauseous. How can I get through the day and get help? So we want young people to understand the signs and symptoms of addiction and be able to reach out to the school nurse, to the counselors, and get help for this.
We're very lucky, Bruce, in Worcester that we have some very engaged youth groups, the Hope Coalition and others that are helping us kind of figure out what's the best way to approach the youth. And I think this is a product of a lot of input from youth. So, I think they have the best ideas about how to reach out to their peers, including some peer-to-peer coaching, which I think is great. So, it's a difficult tide to fight back against, but I think we're not going to leave anything on the table trying to do it.
And the same is true for adults. The same resources that you have available for your clients, for your patients, that are all available on the Make Smoking History website, the 1-800-QUIT line, 1-800-QUIT-NOW, which we want people to know no matter how many times they've already tried to quit, whether it's smoking or vaping, to go back and try again and to use the coaching that is available, getting the FDA-approved resources like the patch or the gum or the medications through prescription. And of course, anybody right now, while this ban is going on, can get 8 weeks of free patches from a pharmacy. And you don't need to have a prescription because there's sort of a general state prescription that's been written now from the Commissioner of Public Health, so that even people who have less resources, it's all available for them.
Well, we just have a couple of minutes left. I'd like to highlight a couple of things that you bring up. Originally, Tina, you were talking about how this was well-funded. The original tobacco tax, which I remember back in 92, 93, I can remember sitting with our legislators, and we told them from the Medical Society that tax would be good if you dumped the money in Boston Harbor. And they went and they put a 25-cent tax on. Now what are we up to, $3? Mm-hmm. And not all that originally was earmarked for anti-smoking campaigns, and they've taken that back. Mm-hmm. And so from what were the figures you were telling me, Tina, about that?
Well, the original funding back in the late 90s, early 2000s was $50 million. So now
for Massachusetts.
For Massachusetts was funded.
And now what are we at?
$4 million. Yeah,
$4 million. So maybe part of our message would be talk to your legislators and say, let's put more money back into funding
prevention.
Smoking prevention or smoking cessation. And I hear our music, so I've got to wish you all thank you very much to our guests, Tina Grosowsky, Dr. Michael Hirsh. I'm Dr. Bruce Karlin. Wishing you a good evening, and thank you for watching Health Matters, brought to you by WCCA TV and the Worcester District Medical Society. Thanks for watching.